Now we will discuss viral type of conjunctivitis. The viral type of conjunctivitis, it is the acute follicular type of conjunctivitis which is characterized by the redness of the eye and watery discharge. We have many type of viral conjunctivitis. We will discuss each of them one by one with their clinical features, their diagnosis and treatment. Okay? The viruses which are causing conjunctivitis, I have made a mnemonic for them, which is form conjunctivitis causing microbes. Each capital letter of this mnemonic represent the virus. Okay, so picornavirus, herpes simplex virus, adenovirus, measles virus, coronavirus, chickenpox virus, and molluscum contagiosum virus. Okay, so these are the viruses which are mainly involved in different type of viral conjunctivitis. First of all, we will discuss adenovirus conjunctivitis. Why? Because this is the most common virus which is involved in conjunctivitis. This virus has 49 serotypes which are named from A to F. Okay, and this virus causes two clinical conditions: epidemic keratoconjunctivitis and pharyngoconjunctival fever. First, we will discuss epidemic keratoconjunctivitis. Okay, so what is epidemic keratoconjunctivitis? It is the acute follicular type of conjunctivitis which is mostly associated with keratitis. Okay, so follicular conjunctivitis mostly associated with punctate epithelial keratitis. The clinical features: the patient will present with redness. Okay, the patient will present with redness, watery discharge, and there will be, if the infection is severe, there are three conjunctival responses. There may be, the patient may have chemosis. Chemosis is the edema of the conjunctiva. When there is the severe infection of the conjunctiva in virus, what is happening? There is the edema will develop in the conjunctiva and the conjunctiva will bulge out. This is called chemosis. Okay, so due to the edema, the conjunctiva will bulge out and it may develop in the patient. Another response is that the patient may develop subconjunctival hemorrhage. So under the conjunctiva, the patient may develop hemorrhage. Okay, the blood will collect under the conjunctiva and will cause the hemorrhage. The third condition is that there may be the formation of zodomembrane. So when there is the viral inflammation, what will happen? That there will be the coagulative exudate. The coagulative exudate will accumulate, and this coagulative exudate will form a membrane. This membrane can easily be peeled off because this is formed by the coagulative exudate, so it can easily be peeled off. That's why it is called zodomembrane. The true membrane, we have discussed the true membrane and membranous type of conjunctivitis in bacterial lecture. Okay, so these three conjunctival responses may be present in the patient: conjunctival edema, which is chemosis, subconjunctival hemorrhage, and pseudomembrane. Okay, and we, as in the definition, it is present that this follicular conjunctivitis is mostly associated with keratitis. So the keratitis is the inflammation of the corneal epithelium. Okay, so the corneal epithelium will be disposally involved. This is called punctate epithelial erosion, keratitis. Okay, punctate epithelial keratitis. So in 80% cases, cornea will be involved with epidemic keratoconjunctivitis. And this keratitis may resolve or it may progress to subepithelial opacities, in which there the cornea will become opaque. Okay, so and the next is that the viruses are most probably causing pre-auricular limb adenopathy, like in we discussed in the gonococcal type of conjunctivitis and membranous type of conjunctivitis. So this condition can also causes pre-auricular, the pre-auricular lymph nodes may be involved and cause limb adenopathy. Okay, The epidemiology of the epidemic keratoconjunctivitis is that this type, epidemic keratoconjunctivitis, is mostly caused by the serotypes 8, 19, 37. It is a highly contagious disease. Its incubation period is about 8 days. Uh, and it can be transmitted from person to person by ocular secretions. Okay, so it is the epidemiology. Now how can we diagnose the condition? We can they are saying that there is no need of clinical investigation because it is a viral condition, and a viral condition is mostly self-limiting. So if you want to investigate, then we can do investigations such as the rising titer of antibodies can be checked. We can do ELISA. ELISA enzyme linked immunosorbent assay method can be applied. We can do PCR. Okay, and there is one important test which can detect the the adenovirus antigen in 10 minutes, and which is highly specific and sensitive. This is the immunochromatography test. Okay, immunochromatography test can detect the adenovirus antigen in the conjunctival secretion only in 10 minutes. But these investigations are generally not required. Okay. The treatment options, as I told you that the epidemic keratoconjunctivitis is a viral condition, so the condition can resolve within 1 to 2 weeks without any treatment. We can get, because this is the viral condition, so there will be the inflammation and immunosuppression, so that's why secondary bacterial infection can develop. And for this we can use antibiotics. Antiviral are not effective so much, so we can give antibiotics. We can also give antiviral, but antiviral are not so effective. Steroids can be used, as we cannot use steroids in infective type of conjunctivitis, whether it is bacterial or viral. But steroid can be used in dilute concentration. As I told you, that this conjunctivitis is mostly associated with opacities. Okay, so opacities will develop. So in order to resolve this condition and remove the opacities, and to the person will feel uncomfortable with these opacities. So for comfortability, we can use steroids in dilute concentration. Okay, this was about the epidemic keratoconjunctivitis. Okay. Now another condition is the pharyngoconjunctival fever, adenovirus also causing this condition. This condition, the epidemic keratoconjunctivitis in the pharyngoconjunctival fever, in clinical features mostly they are similar. In treatment, in clinical features, in etiology, but with these all clinical features, the pharyngoconjunctival fever will have fever. Okay, it will have fever, pharyngitis. Okay, pharyngitis, fever, and these all clinical features. Okay, with the addition of these features, these patients will also present with fever and pharyngitis. Okay, and one more thing, that these clinical features, they will be not so severe in pharyngoconjunctival fever. In contrast to the epidemic keratoconjunctivitis, these symptoms are severe. Okay, and this pharyngoconjunctival fever is caused by serotypes 3, 4, 3, 4, 7. Okay, so these are the serotypes which are causing pharyngoconjunctival fever. The epidemic keratoconjunctivitis, the serotypes are involved are 8, 19, and 37. They are causing epidemic keratoconjunctivitis. And 3, 4, 7, they are causing pharyngoconjunctival fever. Both are similar in etiology, clinical features, diagnosis, and treatment. But these clinical features of the eye, they are severe in epidemic, and they are not so severe in pharyngoconjunctival fever. And with the addition of these mild features in pharyngoconjunctival fever, we also will have fever and pharyngitis.